Aaptas Ayurveda Trust, reach Ayurveda to each. Celebrating its 10th anniversary presents Ayurgrama 3.0, third edition of National Level Ayurveda Contest with the theme Indriya Arogya, Swastha Indriya, Swastha India on behalf of Charaka Jayanti 2026. Organized by Aaptas Ayurveda Trust, Karnataka. Supported and guided by National Commission for Indian System of Medicine. Rashtriya Ayurveda Vidyapith. Prize for the contest is sponsored by Vaidya Chetan Upadhyaya, founder and managing director of Prana Vaidya Group of Hospitals, which has 9 hospitals across India. Sponsored by Vaidya Hari Krishna Panache, founder and managing director of SDP Ayurveda Putturu. Punarvasu 2.0, International Summit on Indriya Arogya. Theme: Harsha, Health Advocacy for Renaissance of Sensory Health through Ayurveda. On 29th and 30th August 2026, Saturday and Sunday at Shri Kshetra Dharmasthala, Karnataka. Be there, be the moment. Swastha Indriya, Swastha India. Register now.
As a part of Ayurgram 3.0, a group of 21 Ayurvedic students, accompanied by 3 of our lecturers, visited Kadabagere village. Our theme for the program was Ayurogya-Swastha and had a brief discussion about the pre-camp and assigned roles among the teammates. The primary purpose of this survey was to assess the health status of the community with special emphasis on the 5 organs. The survey also helped us identify common sensory disorders and understand the area where health awareness and preventive interventions were required. The survey was conducted through a door-to-door household approach involving our faculty members, interns, and undergraduate BAMS students. We used a structured questionnaire consisting of 70 questions covering demographic details, medical history, lifestyle and dietary habits, personal hygiene, occupational factors, and specific aspects of sensory health. Through this survey, we covered a total of 1,000 villages. The information collected gave us a baseline understanding of the health concerns present in the Kadabagere and helped us in planning activities of Ayurgram 3.0 accordingly to the needs of the community. Among the major findings, eye disorders were the most commonly reported problem, accounting for 30%, followed by skin diseases at 22%, nasal and ear disorders accounted for 10%, while tongue and oral cavity related problems accounted for 4%. The eye related complaints included diminished vision, eye strain, watering, itching, redness, difficulty in reading, and symptoms associated with prolonged mobile phone and television use. Skin related complaints included fungal infections, itching. We also identified complaints related to the nose, ears, and such as allergic rhinitis, recurrent cold, nasal blockage, ear pain, and ear discharge. Therefore, the pre-camp survey was not merely a data collection exercise, it helped us understand the actual health priorities of the community, identify individuals who might require further attention, and plan our subsequent awareness and screening activities. On 30th July 2026, we officially inaugurated Ayurgram 3.0 at Kadabagere village. The program was graced by our chief guest, Jila Adhyaksharu Bengaluru North and Srimati Sumalata, PDO Kadabagere, along with Dr. Vivek, program coordinator. The program began with welcome address, invocation, and ceremonial lamp lighting, followed by addressing highlighting Ayurveda, preventive healthcare, and community participation. The inauguration concluded the vote of thanks and presentation of mementos to the dignitaries. Following the inauguration, we conducted a procession at Kadabagere Government High School as a part of our awareness initiative. The main purpose of the procession was to create awareness about Ayurveda, healthy living, and the importance of preventive healthcare among the students and the surrounding community. A special highlight of the procession was the carrying of the sacred Charaka Samhita. This symbolized the rich heritage of Ayurveda and represented the timeless knowledge that has been passed down the generations. The participation of school students made the procession particularly meaningful. Instead of limiting health education to a classroom setting, the students themselves became part of the awareness campaign. Their involvement helped create enthusiasm and encouraged them to understand Ayurveda in a more practical and engaging manner. On 31st July 2026, the second day of Ayurgram 3.0 was conducted at Government Primary School, Kadabagere, with special emphasis on creating awareness among the school children about the five sense organs and their protection. We began with an awareness program on the five Indriyas. The students were taught about the importance and functions of these sense organs and were educated about simple preventive measures to maintain their health. We then demonstrated various Dinacharya practices explaining how maintaining a healthy daily routine and personal hygiene can contribute to overall well-being and Indriya Arogya. Following this, we conducted a session on eye exercises. The students were guided through simple exercises such as blinking, palming, eye rotations, and near and far focusing. We also emphasized good reading posture, regular breaks while studying, limiting unnecessary screen exposure, and maintaining a nutritious diet. One of the practical sessions focused on proper hand washing techniques. A step-by-step demonstration of the 7 steps of hand washing was conducted using soap and clean water. The children were taught to clean the palms, back of the hands, spaces between the fingers, fingertips, thumbs, wrists, and area under the nails. They were also encouraged to practice the technique themselves under our guidance. As a part of the school awareness program, we conducted a demonstration on proper toothbrushing technique. One of our students demonstrated the correct methods step by step, explaining the importance of maintaining oral hygiene and regular brushing for teeth and gums. And finally, the session was concluded by vote taking regarding maintaining a healthy lifestyle. We then demonstrated Trataka, introducing the students to a traditional practice associated with concentration, mindfulness, and visual awareness. The activity helped us connect traditional Ayurvedic and yogic practices with the modern need for healthy visual habits. Another major activity was the eye screening camp. The students underwent individual visual assessment to identify possible vision related problems and were given appropriate advice regarding the eye care and further consultation whenever necessary. A total of 120 students were screened and among them 7 were diagnosed with visual impairment. To make the program more interactive, we conducted a blindfold challenge. Students were blindfolded and asked to identify familiar objects or substances using their senses of touch, smell, and taste. This activity helped them understand how important each sense organ is and how the other senses become more noticeable when the vision is temporarily unavailable. Thus, day 2 was concluded. On 1st August 2026, Day 3, we conducted a home-to-home awareness campaign in Kadabagere village. We interacted directly with the residents and created awareness about the 5 Indriyas and their proper care. We also distributed pamphlets containing information about suitable ahara, dinacharya practices, and important do's and don'ts for maintaining Indriya Arogya. We also conducted an Indriya Arogya awareness session at Bharat police station. We explained the importance of maintaining the health of the 5 sense organs through proper ahara, dinacharya, personal hygiene, adequate sleep, and healthy lifestyle practices. The session provided an opportunity to extend our Ayurvedic health education. After a session in the police station, we all gathered at the Panchayat office. As a part of Day 3 activities, we also performed Shloka Parayana from Sushruta Samhita. All our team members participated in the collective chanting of selected shlokas. This activity helped us connect our community program with the classical foundations of Ayurveda and also promoted concentration, discipline, and appreciation of Ayurvedic knowledge. After winding up Day 3 activities, we started preparation for the camp that was going to be held on the 4th day of Ayurgrama 3.0. On the 4th day, 2nd August 2026, we conducted the General Health Camp at Kadabagere village Panchayat office as the major clinical component of our Ayurgrama 3.0 program. The camp was organized to provide the community with accessible screening, consultation, and preventive healthcare services. Based on the health concerns identified during our earlier community interactions and survey, The camp included general physical examination, blood pressure monitoring, blood sugar testing, and eye examination. The community members were assessed by our team, and those requiring further attention were appropriately advised for consultation and follow-up. A major focus was eye health, considering that eye-related complaints were among the prominent concerns identified during our pre-camp survey. Through screening and individual assessment, we aimed to identify vision-related problems at an early age and create awareness regarding proper eye care and preventive measures. Along the screening, the camp provided an opportunity for direct interaction between the healthcare team and the villagers. We could understand their health concerns, provide appropriate guidance, and emphasize the importance of timely examination rather than waiting until symptoms become severe. The camp therefore brought together the different stages of our Ayurgrama 3.0 initiative, the initial survey, community awareness, preventive education, and finally direct health screening and consultation. Overall, Day 4 was an important step in translating our awareness activities into practical healthcare services and strengthening the connection between Ayurvedic healthcare and the community. On Day 5, we conducted a yoga and pranayama session for the high school students with the objective of promoting Indriya Arogya through yoga and breathing practices. We first introduced the students to the importance of maintaining the health of the five sense organs and explained how yoga and pranayama can support concentration, mental clarity, and overall sensory well-being. The practical session included simple yoga asanas followed by Anulom Brahmari Pranayama and deep breathing exercise. The students actively participated and were guided to perform each practice posture and breathing technique. We also emphasized the importance of adequate sleep, balanced diet, proper posture, and limiting excessive screen time. The students were encouraged to incorporate yoga and pranayama into their daily routine as simple measures for maintaining Indriya Arogya. We conducted an awareness session on introduction to sense organs and Indriya Arogya. The session focused on the importance of the five Jnanendriyas, Chakshu, Shrotra, Grahana, Jivha, and Sparsha, or the eyes, ears, nose, tongue, and skin. The participants were explained the important role of these sense organs in perceiving surrounding and maintaining overall physical and mental well-being. We emphasized that their health can be maintained through proper dinacharya, balanced ahara, personal hygiene, adequate sleep, and healthy lifestyle practices. We also discussed the harmful effects of excessive screen time, loud noise, unhealthy dietary habits, poor hygiene, and environmental pollutants. Finally, simple preventive measures were explained and the session concluded with an interactive discussion. We conducted an IEC activity focusing on lifestyle guidance for maintaining Indriya Arogya. Participants were educated about dinacharya, satvritta, appropriate ahara, adequate sleep, personal hygiene, while also being advised to avoid excessive screen time, unhealthy food habits. To make the program more interactive, we conducted memory enhancement activities for the students, where 22 different objects were displayed for 30 seconds. The students then had 1 minute to recall and write down as many items as possible. This was followed by the memory chain game, where students had to remember and repeat a sequence of fruits and vegetables while continuously adding a new item. These activities encouraged observation, concentration, memory, learning skills, and cognitive development. We conducted a Swachh Abhiyan at the Kadabagere Panchayat office. All our team members actively participated in cleaning the premises by removing litter, sweeping the surroundings, and ensuring proper waste disposal. Through this activity, we promoted clean surroundings, environmental hygiene, and community responsibility, reinforcing the message that a clean environment is an essential part of healthy living. Day 6, 4th August 2026. As a part of Ayurgrama 3.0, we conducted an interactive session called Pariksha Pe Charcha for the students of Kadabagere Government High School. The session focused on the importance of adequate sleep, concentration, memory, and mental well-being, especially during examinations. We explained how insufficient sleep can lead to fatigue, poor concentration, and increased stress. We also connected examination preparation with Indriya Arogya, emphasizing proper eye care, limiting excessive screen time, maintaining a nutritious diet, and following a healthy dinacharya. We conducted an essay writing competition on Indriya Arogya for the students. The students expressed their understanding of the importance of maintaining the health of the five sense organs through Ayurvedic principles and healthy lifestyle practices. Their essay highlighted balanced nutrition, personal hygiene, adequate sleep, dinacharya, and limiting excessive time of screen. The activity encouraged creativity, improved their writing and communication skills, and helped them understand the importance of preventive healthcare. The best performing students were also recognized and given gifts. As a part of our awareness program, we created a wall of promise for the students. After attending our various sessions on Indriya Arogya, we asked each student to write down one healthy practice or change they promised to follow in their daily life. Through this activity, the students made a personal commitment towards protecting their sense organs and maintaining a healthy lifestyle. It made the awareness program more meaningful by turning what they have learned into a personal lifelong promise. We conducted an educational session on Navegan Dharana, explaining the Ayurvedic principle of not suppressing the body's natural urges. The students were introduced to natural urges such as urination, defecation, sneezing, yawning, hunger, thirst, sleep, tears, and vomiting, and were explained why these should not be intentionally suppressed. We also conducted a yoga and pranayama session for the students to promote physical, mental, and sensory well-being. The session included simple yogasanas, Anulom Vilom, Brahmari Pranayama, and deep breathing exercises. The students actively participated and were guided to practice these techniques correctly. We explained how regular yoga and pranayama can support concentration, reduce stress, and promote overall well-being. We also emphasized healthy habits such as adequate sleep, proper posture, balanced diet. Finally, our day 6 concluded with a oath-taking ceremony which the students promised to follow throughout their life. Day 7, 5th August 2026. As a part of our Dinacharya awareness, we demonstrated proper toothbrushing technique to the students, emphasizing regular brushing and oral hygiene as important practices for maintaining Indriya-Swastha. We conducted a demonstration on Kavala and Gandusha for students of Giddenahalli School. We introduced these traditional Ayurvedic oral hygiene practices and explained their importance in maintaining oral cleanliness and health. A drawing competition on the five sense organs was conducted, allowing students to creatively express their understanding of Indriya-Swastha and its protection. In the Pick and Speak competition, students selected topics related to the five sense organs and spoke about them, helping develop their awareness, confidence, and communication skills. During the program, our distinguished guests were respectively felicitated with a shawl and memento as a token of gratitude for their valuable presence and support. Finally, we conducted the valedictory program of Ayurgrama 3.0, marking the conclusion of our 7-day community outreach program. The program began with a welcome, followed by a reflection on the various health awareness sessions, screening activities, school programs, and community outreach activities conducted throughout the week. The contributions of our faculty members, interns, students, volunteers, and the entire Ayurgram team were acknowledged. Special appreciation was also expressed to Sri Manju sir for sponsoring lunch throughout the 7-day program. The function concluded with words of gratitude to the dignitaries, faculty, students, volunteers, sponsors, local authorities, and community members for their support and participation.